Is it possible to end AIDS as a public health threat by 2030? The United Nations thinks so, and the guests on this podcast series certainly hope so. But it's going to take effort, innovation, connections, and funding. Welcome to Can We End Epidemics, a podcast series by the global biopharmaceutical company ViiV Healthcare, in association with its majority shareholder GSK, and developed by FP Studios. I'm Henry Bonsu. Now, the global economy is in a state of uncertainty. Governments around the world are cutting budgets, tightening belts, enforcing unforgiving austerity measures, and prioritising spending in the face of instability. Amidst all that, how can national health systems and the international community provide dependable long-term funding to end infectious disease epidemics? That's the question for today. With us are Peter Sands, who is the Executive Director of the Global Fund to Fight AIDS, Tuberculosis and Malaria. Also with us is Dr. Ricardo Baptista Leite, who is the Chief Executive Officer of HealthAI, the global agency for responsible AI in health. He's a medical doctor and former Portuguese Member of Parliament. And Helen McDowell is Head of Government Affairs and Global Public Health at ViiV Healthcare. Thank you very much for joining us, Peter, Ricardo, and Helen.
Thank you.
Hey.
Thank you.
Right. I'm going to start off with Peter. At the last replenishment in New York, at the UN General Assembly in 2022, everybody was excited because despite the headwinds, despite COVID, the world came together to raise $15.7 billion, a record. But here we are, worried about the global headwinds, about finance, about instability, and about a commitment to funding the eradication of HIV and AIDS. Peter, why are we so concerned, given that, in the case of the Global Fund at least, we're raising record amounts of money?
Well, you're right, Henry. Not only have we raised record amounts of money, but we are currently investing record amounts of money. In 2023, we invested about $5.1 billion to fight HIV, TB, and AIDS. And roughly half of that was HIV, AIDS. But we do face a very challenging global economic environment. Most overseas development budgets are under constraint or even being reduced. And many of the countries in which HIV/AIDS is most present are facing acute fiscal problems, debt crises, and so on, which makes it difficult for them to finance their programs. We also have the problem of having been successful. Since 2002, when the Global Fund was created, deaths in the countries in which we invest have fallen by 72% and infections by 61%. So a lot of people think, oh, well, is HIV/AIDS no longer a problem? And that's incredibly dangerous because HIV/AIDS is a formidable opponent. And what we have seen is that if people get complacent and let it come back, it will come back. And we are seeing this now in places like the Middle East and Eastern Europe, Central Asia. We are seeing the epidemic actually increasing, while in the places in the world that we put most of our resources, such as in sub-Saharan Africa, we continue to see a very strong reduction in both deaths and infection rates.
Ricardo, as well as being a medical doctor, you are also the president of Unite, which is a network of parliamentarians for global health. Can you explain how you see things from your perspective as a former member of parliament in Portugal?
Well, when I decided to create the Unite Parliamentarians Network for Global Health back in 2017, at the time it was just a vision. Today we are in more than 110 countries, and actually we started off with a particular focus on infectious diseases, including HIV, AIDS, malaria, and TB, because there was a feeling of a growing disconnect, if you will, between the political world and the political priorities and those of actually, as Peter was saying, getting the job done, of ending these diseases. it was a clear perception that we needed to galvanize the power and the will of those representing the people in parliaments, congresses, and senates around the world, because they are the ones that actually legislate. They are the ones approving budgets and keeping governments accountable. Well, I believe that our mission is as important today as it was back in 2017, if not more. But the truth is, the geopolitics of today are putting everything at risk. And we need to start preparing the world for Plan B if we start seeing countries taking steps back. Because when it comes to infectious diseases, my career started as a medical doctor in infectious disease, and I can tell you, every time you lower your guard, infectious diseases will come and bite you harder than before. And that is where we are at this point right now. We have a unique opportunity. We have science. We have many tools we can deploy to make sure that we can stop these epidemics, but we need to make sure that the resources and the political will are aligned. I would say that we have to be united more than ever, and thus our work through the Parliamentarians Network.
Let's move to you, Helen, because you are Head of Government Affairs and Global Public Health at ViiV Healthcare. So what kind of conversations are you having with governments around the world to make sure there is no backsliding of the kind described by Ricardo and Peter?
That is our number one priority in terms of our government affairs engagements, both on the domestic level, but also in terms of international aid. We are off trajectory in countries around the world, not just in the developing world, with regards to HIV and AIDS. And we are at risk of complacency in thinking that the job is done and not seeing it through to the end. This isn't just about the technologies and the innovation. This is also about policy. And it's really important that there aren't governments with punitive regulations or laws that actually prevent people from accessing treatment and care and services. So working with advocates and on our own to really make sure that policies and laws are not getting in the way of all the different populations impacted by HIV from accessing the treatment and care that they need.
Thank you, Helen. Let's stay on financing, because I've been, in preparation for this conversation, monitoring what you've said publicly, each of you. And Ricardo, I've homed in on something you said. You say it's not really about the quantity of health financing, but the quality. What do you mean by that? How can the quality be improved if it isn't just about getting even more and more at each replenishment?
It's a question of making sure that where we apply the resources actually have the impact that we desire. And what I mean by this is that for too long, we have been focusing too much on building institutions, on investing in equipment, but not actually understanding what is the outcome that we're getting from it. And I'll give you an example of something that concerns me deeply. I'm a strong supporter, as all of us, of universal health coverage. The issue is, what do we mean by this? The truth is, in richer countries of the world today, most of our health systems are really not health systems. We live with disease-driven models that react when people get sick. And this is leading to more and more expense, more and more costs, to a point of lack of sustainability, at the same time as we're seeing a rise of the burden of disease, particularly chronic diseases. Under the umbrella of universal health coverage, we're seeing a lot of investment going to low and middle income countries, which in reality is reflecting an exportation of this broken disease-driven model from rich countries into poor countries, where sometimes investing more in a digital transformation of the health system would have much more impact than actually building a new hospital for which there are no healthcare workers in that region. These are hard decisions. And I can tell you as a politician, it's easier for a politician to be on the front page of a newspaper with a new hospital that is just opening, a shiny object that everybody can see, than doing sometimes the backroom things that you need to do and making sure that the logistics are working, making sure that you're putting technology and AI and digital to the service of the people that is not as visible, but actually can lead to better health outcomes. So when talking about investing in health, part of the secret of success, it's focused on achieving results, on focusing on results and then being accountable about that, but also making sure that there's a matching system when appropriate, bringing in domestic funding along with the private sector funding. All of this is critical because that's how you build trust, but most importantly, that's how you transform systems towards being focused on achieving the goals you want to achieve. We cannot give ourselves the luxury of spending money on things that do not lead to better health for citizens on the ground. And that is the change of mindset that in a time of financial constraint becomes even more important, especially if we want to make sure that what we are investing in has a longevity, has the sustainability in the long run, which means, of course, in the future, looking into issues that go beyond the reaction to the disease, but actually promoting health and preventing health and focusing on the determinants of health as critical aspects that have to go in parallel with the care services that classically health systems are providing.
Helen, you were nodding a few times, I noticed, and I'm just wondering what you were responding to, because as a biopharma company, I mean, you're not a charity, you do have an ethical dimension, of course, but this needs to make financial sense too.
Absolutely. And I was nodding because I very much agree with the principle of the quality being key. And I think also Ricardo's point around things being targeted and the need to make those trade-off decisions. And those should be driven by health impact potential versus political agendas. And I guess probably a little bit of me is smiling because obviously we all know politicians around the world are often doing things for their own personal political careers and agendas. That's a particular challenge this year, given the huge number of the world's population who are voting right at this juncture of the decade. But for us, I think it is very much about quality. And that's why we continue to try and push quality of the treatment and care options that we have available. The other piece to me that Ricardo was talking to is that pivot that I think we need governments to have in terms of seeing healthcare as an investment, not as a cost. And they see it as an investment for the future of their societies. And the reality is that that's not how most national health systems have been set up. They were created, most of them on the back of World War II, and were really sort of treat and cure type scenarios. And we really need that to pivot quite significantly to be fit for the future. And so I think, being targeted, being more focused, we are very much as an innovator company really interested in reaching marginalized populations who currently continue to be left at the sides. That's going to be really important. Can we use together with governments and community members digital and AI tools? And can we target and move the funding in a much more specific and focused way to get behind those? And does that give us more likelihood of hitting that target of ending HIV by 2030? I think there's lots to explore there.
Peter, Helen talks about a pivot and AI. Ricardo also talks about rethinking, redesigning how we run our health systems from this response to disease to something more preventative, looking at investment. How much of a pivot are you doing at the Global Fund, bearing that in mind?
Well, what I would say is that we are trying to support governments and communities in their pivots. The issue I would say on the technological front is there's almost too many ideas and pilots. And actually what you need is scalable, robust solutions that can be rolled out at real scale. The other thing I would say, and just sort of picking up on Ricardo's points about UHC, many governments that claim to be on the path to UHC aren't really quite as good at the U bit,
The
universal bit, as they need to be. And this is where the policies, discrimination against men who have sex with men or sex workers, or policies that make it harder for people to access these services are absolutely crucial. You can't have UHC if the people who are most at risk are excluded from the U. That just doesn't work. And so when I look at HIV/AIDS at the moment, I would say part of the challenge is money, but it was ever thus. Although we're facing challenges on the money front, it's the direction of travel on the kind of human rights front that is really concerning me most.
Ricardo, I'm going to go to you as somebody who is at the heart of a network of parliamentarians. How much of a challenge is it to persuade your colleagues in countries and among governments where there may be a historical or cultural antipathy towards, for example, men who have sex with men, to persuade them that actually you have to overcome this and understand it is in the wider interest of your whole population for this to be tackled?
Yeah, that's one of the most difficult challenges, I would say, because it goes far beyond politics. It involves culture. It sometimes mixes it up with religion and with other, even philosophical approaches to ways societies are built up, that it demands from all of us consciousness that we cannot approach a country or a region with specific challenges coming from our own mindset, but trying to understand where those leaders are coming from, be in this case politicians and parliamentarians. And that's why we try to promote as much as we can study tours to show not only the power of investment in health, but also the power of good policy. Because good policy can save lives, but bad policies can kill people. And that, I think, is extremely important for people to understand the power of policy. I come from Portugal, as you said. In the 1990s, more than 1% of the population was having a problematic use of heroin at the time. The injecting drug use was the main cause of HIV infection in my country. That's why Portuguese legislators at the time decided to decriminalize drug use. It was the first country in the world. And to say that no matter if you have heroin on you or cocaine, you will never go to jail. It's not legal, but you will never go to jail. And instead of jail, we will be providing you with health services, psychology services, harm reduction services, and so forth to support you in your journey. That led to a major transformation that did not lead to more drug consumption. Actually, Portugal is below European average, but it actually led to having 0 people in prisons for using drugs in our country. And more than 60% of new HIV infections that were caused by injected drug use, today that number is below 2%. And so good policy can save lives. And it's showing these examples that I have seen parliamentarians coming from regions where their constituents are saying that, having certain approaches that one could consider more Western or more from the high-income countries, they start understanding that there's a science behind it and that there's impact and that they could actually save lives within their communities. And then we have to make sure that the parliamentarians have the support of the people on the ground, because at the end of the day, parliamentarians are serving their constituents. If they are doing something but everyone is against them, they'll be voted out of parliament.
I've been looking at some facts and figures, and since the peak of the AIDS infections and deaths in 2004, the headline figure, deaths dropped by 69%. We know what works. The technology is improving all the time, the toolkits, the access, and people's life expectancy. But still, there are funding gaps, and many countries are struggling to fulfill. Let's take the Abuja Declaration, dedicating at least 15% of their budget to the health sector. I think as of February 2023, only 2 African countries, in South Africa and Cabo Verde, managed to achieve that. So there is a gap. The question is, how is it going to be filled? Now, Peter, you're a man with a finance background, and I remember on many occasions hearing people talking about blending finance, innovative financial instruments, etc. What do you make of that? How realistic and how practicable is it to expect, whether it's ViiV Healthcare or multilateral institutions, development finance institutions, to invest in an area, whether it's HIV/AIDS or healthcare more generally, in very poor countries, if they don't see a return in their investment or they think it's just too risky?
Well, first of all, AIDS was an explosion, was a disaster. It was a pandemic. And we're looking in total at over 35 million people have died. And so the fact that now we're talking about it with annual death toll of still too many, but it's in the 630,000 level, is an achievement. But we've made more progress on reducing death than we have on reducing infections. And ultimately, we have to reduce the infections if we're to end the epidemic. Now, in terms of the financing side of it, to start with, ultimately, winning the battle against HIV/AIDS in a sustainable manner requires governments themselves to step up and to pay for their care. And that requires tax. And indeed, I've said before that UHC, universal health coverage, should actually be spelt TAX, tax, unless the government is prepared to both raise significant funds from its population and actually commit. And the Abuja Declaration, remember, is only 15% of the budget, actually commit a significant proportion of the budget to health, you're not going to get UHC and you're not going to beat diseases like HIV/AIDS. And to put this in context, most European countries are spending well over 20-25% of their fiscal budgets on health. Some of them are spending in the 30s. Getting to 15 should be a floor rather than a ceiling or a real milestone in that sense. So ultimately, fiscal sustainability of health in general and HIV/AIDS in particular is a political decision. And this is why I think the work that Ricardo has been doing through Unite is so important, because ultimately you need parliaments to be legislating that level of commitment. You asked about blended finance, innovative finance. There is a role to be played through different types of financial instrument. Blended finance is where you bring down the cost of a loan. What the Global Fund sometimes does is we pay the interest on a World Bank loan, which makes it cheaper for the countries to use that money for delivering on a health objective. But it's a bit of a stopgap. I don't think we should kid ourselves that that is true sustainability. It helps governments achieve programmatic objectives. It reduces the burden of HIV/AIDS, but it's a step along the path. It also doesn't really work that well because in the very poorest places, these countries are already over-indebted. The proposition to private sector providers of capital is weak because there's often poor governance and often conflict. And so it shouldn't be thought of as an alternative, frankly, to development assistance in the form of grants. The very poorest countries are still going to need that if they're going to get on top of HIV/AIDS. And I think it's important to say, sustainability is much easier when you've got a reducing problem. It's very hard to hand over to an overstretched government a growing problem. And so what we can do as external funders is help governments and communities get on top of the problem, begin to drive it down, and then manage a transition to domestic financing. But again, we have to be very realistic. In the poorest parts of the world, given the extent, the way the global economy is working, the extent to which so many are overstretched on debt or racked by conflict or both, this is not a short-term proposition.
Helen, I'm struck by what Peter said about the offer to the private sector in some of those countries. It's a weak one. I'm just wondering how weak and what your assessment is when you see a country where the need is absolute. You could make a difference, but you worry about some of those extraneous factors.
Yeah, it's a really important question, Henry. The reality is that when we're operating in low-income countries and least developed countries, we don't make any commercial profit or return in those countries. So we sell our medicines at a non-profit and we patent share, etc., to make sure that our innovations are accessible in those settings because they are crucial and we believe that they add value to those responses. Our commercial return for our shareholders comes through our work in high-income countries and tiered and then some input from middle-income countries. But that business model is critical to actually enable us to offer our medicines at non-profit prices in the countries that are hardest hit by the epidemic. So it's a challenging one because ultimately we're not really investing financially in those countries. We might include them in clinical studies and we would make sure our medicines are available, but we're not looking to profit from those settings for the very reason that they don't have the affordability to do so. And we can't sort of give medicines for free because that wouldn't enable us to continue to invest in the innovative research to develop the innovations and the products for tomorrow, both for treatment and prevention and hopefully ultimately a cure.
Ricardo, to you as a former parliamentarian, Peter said that it really is for the governments to raise taxes from their populations and then spend it wisely on health. I mean, 15% should be a floor, not a ceiling. Can you talk to us about some of the countries that you have experience or knowledge of where you see impressive moves towards a greater domestic resource mobilization instead of depending on Peter or multilateral institutions who spend huge amounts on people's healthcare budgets?
There are amazing countries that have been investing tremendously, as is the case of Cape Verde that you mentioned, that has hit the 15% mark. I know them very well as a Portuguese-speaking country. And I must say that what is relevant about that example, it's not just about the money, but it's the spirit at which the investment is made, the willingness of the government to look at best practices around the world, not just in terms of how to invest the money, but also how do you actually make laws that are more efficient? How do you ensure that human rights are protected? How do you protect the rights of those that are in most vulnerable situations, young girls, children, young women? To see that kind of mindset towards governance can be transformational, even if you don't have the money. Then, as Peter was saying, I think thinking about innovative ways of financing and getting the rest of the world on board. And as Helen was saying, the private sector is willing to be part of this process. I think we need to be more open to this kind of collaboration. But just at the G20, I was there in Brazil just recently at the health work meeting. And there's a huge discussion about investing more on something the Global Fund has been promoting for years, which is debt for health or debt swaps, where basically rich countries are forgiving debt, but making sure that the money that would be used to pay the debt, instead of being used to pay the debt, is used to be invested within the country. So it's a question of where do we create the incentives and making sure that those investments are actually having a reproducible approach so that that could lead to better health for the population, a more productive population, and hopefully more tax-paying population. Because at the end of the day, it's possible to transform the way we organize our societies to be more conducive to the process of actually leading to sustainable healthcare for all.
Thank you, Ricardo. There is one more thing missing. There is one elephant in the room we haven't mentioned yet, but it is climate change. And if you look at the statements from governments, from United Nations organizations, from NGOs, we're not on track to meet the targets set in previous COPs. And I know that you, Peter, at the Global Fund, are adapting your funding to deal with this challenge. A significant percentage of your funding is going to be spent in some of the most climate vulnerable countries. Can you talk a little bit more about that and the agenda going forward?
Yeah, I mean, 70% of the Global Fund's funding goes to the top 50 most vulnerable countries from the impact of climate change. Climate change is going to hit the people who are poorest and most vulnerable to infectious disease hardest. The global health community has, I think, been a bit slow to wake up to the threat of climate change on people's health, particularly the health of the poorest. We were distracted by COVID-19 for obvious reasons. And the climate change community has been slow to focus on the health impacts of climate change. And that's something we've got to change because it's happening already. We are seeing people dying because of these effects. When the big floods happened in Pakistan a couple of years ago, I think the number of deaths from malaria quadrupled. And we saw many more deaths from malaria than we did from drowning from the floods. And what's even more concerning is that now, a couple of years later, even now, malaria infections are twice as high as they were before the floods. So that we're now going to have to work to get them down again. And Pakistan is a relatively low malaria incidence country. The threat is even more acute in those places where the starting point is higher. And it's not just malaria. Of course, there's other vector-borne diseases like dengue or cholera, but also diseases like HIV and TB flourish in the kind of disrupted circumstances when you have mass migration of people. And this is what we're beginning to see more and more of. Certain parts of the world become too hot to live in, where we see desertification, where we'll see more and more mass migration. There's nothing that, as a disease, TB likes better than large numbers of people in refugee camps, stressed, malnourished. And so that kind of second order impact on other diseases is one thing we're also very focused on.
Helen, I'm just wondering how far you factor in the threat of climate change, the real world impacts of climate change into what you do at ViiV Healthcare.
Yeah, so this is something that I'm personally passionate about, but it's also something that is of growing importance, I think, to the whole industry, because I don't think we have a clear picture for all of us working across governments, across industry, across the community as to what actually could that picture look like if we don't get ahead of HIV now whilst we have the tools. And I think we need to tell a better longer term story so that people can really get behind why we need to act now, why we need shared commitments across political parties and across countries that are fully invested in. Otherwise, we're not going to succeed on this.
Right, and given all of that, Ricardo, I'm going to ask you as the medical doctor on our panel today, can we really achieve that holy grail of ending AIDS as a public health menace, as an epidemic, by 2030?
We have to. That's not a question of if, but how. We have the tools, we have the knowledge, we have the science. We know exactly how to get there. It's a question of making sure that we put the policies and the resources aligned to reach that goal. Of course, there are many threats. We focus more on the threats, I would say, over this last conversation than on the hope. But we are also seeing pockets of hope around the world. And as Peter was saying, we should also highlight those positive examples as a lighthouse to lead us forward. With the rise of conflicts around the world, with the geopolitical divide. I mean, we just went through a pandemic with COVID-19. And governments are not even able to agree upon signing an accord that will actually prevent the next pandemic. That's where we've gotten because of all of the geopolitical tensions that we are living today. So I guess politics may actually be the greatest hope or the greatest divider when it comes to these challenges we have ahead. We need to continue focusing on showing how it is possible. I believe it is. So my answer is of hope. And I would say, coming from the HIV movement as a medical doctor many years ago, we need to rekindle that fighting spirit from the 80s and 90s. But this time, not just to save lives, but actually to get the job done and end AIDS as an epidemic. I think we can do it.
Ricardo said it brilliantly. It's ending AIDS is perfectly possible. We just need the political will to do it.
Yeah.
Dr. Ricardo Baptista Leite, Helen McDowell, and Peter Sands, thank you very much indeed. You've been listening to Can We End Epidemics? A series of 6 episodes where we discuss disease prevention, health inequalities, the future of medicines and health funding, among other issues. Do check out the glossary in our show notes for any terminology you may have missed. I'm Henry Bonsu. Thanks very much for listening.